Have you ever noticed how diligently people with cars going for maintenance or repairs? The slightest knock, unusual sound that is coming from the car, and they are straight at the mechanic shop. However, many of you don't always have that same mindset when it comes to your body and your health. Sometimes things can happen in our body that may seem minor, and a mechanic kitchen may look to it and shake it off as if they have a issue. Health problems not be thief in the night that creeps up on you when you least expect it. It comes with important signs that people, young and old alike, are too quick to dismiss until it's too late. See, in the medical world, signs and symptoms indicate when something is wrong with your body. For example, one small rash may be a sign of a skin condition. An elevated blood sugar can indicate diabetes and should be evaluated by doctors so that they can be effectively treated before they turn into more serious problems. So here are 9 symptoms you should never ignore when you notice them in your body. Number 1, chest pain. Can be dull, aching, pressure, sharp, stabbing. But when you notice intense chest pain or a sense of heaviness in the chest, it could be a sign of a heart attack. And it can also be caused by many other less serious conditions. But don't wait to find out the less serious condition. Go to your doctor immediately you find out. Especially, when you feel like it's radiating towards your arm. Especially your fingers, your arm, or feel like it's radiating towards your back. Please go see a doctor. Number 2, feeling full after eating very little. See, if you eat very small and all of a sudden it feels like you cannot eat enough again, go and get checked at the hospital. What you might have is this feeling known as early satiety. Possible causes of this: reflux disease, there's food coming back upside your esophagus, even peptic ulcers. And in some cases, it can be a more serious problem, such as stomach cancer. Now, number 3, blood inside your stool, your urine, your vomit, or non-menstrual bleeding. Look, there are many reasons why blood can appear in your urine or your stools. It could be disease, it could be trauma, it could be infection, it could be tumors, or even some abnormalities, because under normal circumstances, there should be no blood present in either of these systems. Even the smallest amount of blood can show that something is occurring. And also, if you see bleeding in a woman who has passed menopause, she has to see a doctor. Very important. Number 4, abdominal pain. Yes, your abdomen. Whether it's crampy, achy, dull, intermittent, sharp, it's called a stomach ache. The space between your ribs and your hip region is your abdomen, and there are too many organs inside here. Now, when something goes wrong with some of these organs, sometimes it can be a life-threatening situation. So see your doctor if that pain is severe, persistent, and abnormal. It could be appendicitis, could be your intestines are blocked, could be a gallstone, could be a host of other conditions. It could be something's wrong with your liver, but it's plenty. We don't have time to go into it. But severe, persistent. Persistent means that it's always there. Please go see a doctor. Number 5, flashes of lights, right? If you start seeing bright spots, flashes of light, especially in a dark room, that can be a sign of a migraine and it's not your village people. In other cases, it could be a sign of a very serious condition in which there's a layer at the back of your eye. If it pulls away from that position, it's called retinal detachment. You need immediate care by an eye doctor called an ophthalmologist that can help prevent permanent blindness. So pay attention. Flash of light is not police. It's your eye. Number 6, painful intercourse. Look, yes, when pain inside intercourse or during intercourse, sometimes it could be caused by some things like dryness and allergic reaction. However, there are some more serious issues: endometriosis, UTIs, that's urinary tract infections, vaginal yeast infection, sexually transmitted diseases, or even vaginismus. I shot a video on it before. If you feel pain at the entrance or even deeper pain during penetration, it's a head up that something is not right somewhere. Sometimes it could even be caused by PID, right? It's not a problem that is limited just to women, even men. If you notice that you have pain during sex, please go see your doctor. Number 7, you're always tired. Look, many of us are busy and stressed and exhausted due to everyday life concerns. But if you're always tired, and this seems different from normal tiredness and doesn't even get better even after you get enough sleep or rest, it might be a warning sign that you need to discuss with your doctor. Sometimes fatigue can be a signal, for many serious problems. It could be you have low blood, anemia, it could be diabetes, it could be depression, it could be sleep apnea, it could be even chronic fatigue syndrome, it could be kidney disease, it could be heart disease, it could even be cancer, right? Now, headaches. This one is very personal to me because many of us get headaches now and then, and some go on their own after eating, some even after drinking water, some even after you rest, some after you take an over-the-counter medication. But there's some headaches that prompt medical attention immediately. The headache is becoming more frequent, more severe than normal, doesn't get better with medication, interferes with your work or other daily activities. They should be seen by your doctor. My own was a tumor in my brain. Fever, look, a fever is just your body trying to fight off something. Sometimes it's an infection. So your body thinks that, if I can increase the temperature of the body, the virus or the bacteria that's causing this infection may not survive. And so it increases the temperature of your body. What it's doing, that's vibrating the muscles generate energy generates heat, increases the temperature of your body. Usually most fevers go on their own, but if the fever is persistent, right, you might need to see a doctor. If the fever is higher than normal,